Good afternoon. On the account of World Heart Day on 29th of September, today I'm giving you your talk on the angina, or it is the chest pain, the cardiac pain or a chest pain. I am Dr. Shobha Naidu, physician at Sagar Hospitals, Bangalore. And on this account, a little amount of awareness for the public is what I would like to consider today. And I'll be talking on angina. What is angina? Angina pectoris is chest pain or discomfort that occurs when the heart does not get enough blood and oxygen. Most often it is known as an anginal pain. I think many times this angina pain is something which precedes a heart attack. So when a patient has a heart attack, the pain which he gets initially, the on and off pain, the milder form, the subtler form of that severe pain and discomfort what he gets is the angina. And if you get this neglected, it can progress to a complete heart attack, which is called as myocardial infarction. So what causes this angina or chest pain? The most common cause of angina is because of the reduced blood supply to the heart. And this poor supply to the heart and the blood vessels occurs when the blood vessels are getting clogged and the blood supply gets very narrowed to the heart. It's like a pump. You have the plumper and the water flow tubes in which the rust gets in. A similar way, the cholesterol or the fat deposit in the blood vessel can narrow the blood supply, and this blocks or prevents the further blood supply to the heart. And when the heart does not get the blood, and the blood carries the oxygen and the nutrition, when this oxygen gets cut off to the heart muscle, that is when the heart is in pain. It is crying, saying that I'm dying. And that is called as the angina pain. So what are all the reasons which can cause this blood clotting? It's a blood clot itself in the blood vessel. It can be a blockage in the artery that can rupture and then proceed forward. There's reducing pumping activity of the heart muscle. So when the heart muscle, they have less pumping action, less blood supply, less oxygen to the heart. And when there's very stiff in the arteries become very stiff because of age, then again the arteries cannot be very compressible and the blood flow is very reduced. So these are the causes why we get the chest pain. How does a patient have symptoms? What are the signs and symptoms of angina? Will person always have the same symptoms? Very good question here, I think. Generally, the chest pain is a typical form of angina, which affects most people in different ways. But the most common one is a pain which is very pressing, which is very squeezy pain or crushing pain in the chest or in the center, or it can come to the left side. Sometimes it can come to your right side. It can come to your neck, your jawline. It can also come to your left arm pain and also to your upper back. Any pain which comes in a squeezy pain in this, which is not explainable, which increases on exertion, is very much a cardiac pain. And very much again, sometimes this pain, especially in patients who are diabetes, who are taking medications like beta blockers in hypertensive patients, this pain or the chest discomfort may not present as pain. They can feel as shortness of breath, they can have weakness, they can feel tiredness, they can be fainting, and they can also have syncopal attacks. All these are known as equivalent to an angina or symptoms which resemble anginal pain. So what are the treatment options for chest pain or angina when it happens? Whenever you experience a chest pain, you should visit immediately.
Ma'am, your mic is off.
Describe appropriate medicines to you. Your healthcare provider may prescribe medicines if you have angina. This medicine helps to reduce the pain in your chest by broadening or dilating your blood vessels. This lets more blood flow to your heart muscle and decreases the workload on your heart. Can angina pectoris be prevented? Yes. If you can consider quitting smoke, controlling your diabetes and cholesterol within the normal limits, you can definitely, to a large extent, reduce anginal pectoral pain. What are the other conditions you need to do? Is eating a healthy diet, maintaining a healthy weight, getting physically active once you have your doctor's approval. Aim for at least 150 minutes of moderate activity every week and at least about 10 minutes of strength training twice a week, reducing your alcohol consumption, and taking medicine as prescribed by your doctor will definitely reduce your angina. Ignoring chest pain can be fatal, thus, it is always better to keep your doctor informed about your symptoms. Right treatment at right time can prevent any major cardiovascular complications. Please take care of yourself. You are very important. Thank you.